One. Hi, I'm Dr. Sheila Reyes from the Philippines reporting for Room Now at the virtual ACR 2021. MRI is an important imaging modality in the evaluation of patients with rheumatic disease. Increasing data have shown its utility in the diagnosis of early rheumatoid arthritis among patients with clinically suspect arthralgia and also as a potential tool for monitoring disease activity or progression in the spondyloarthropathies. I want to talk about two interesting studies on MRI presented during day one of the abstract session. First off is the study by Dr. Bastian van Dijk. I hope I pronounced his name right, and his team, Abstract 468, where they assessed the association between the occurrence of inner metatarsal bursitis and progression to clinical arthritis. They studied a large number of patients, around 577, who presented with clinically suspect arthralgia and were followed through for development of clinical arthritis. They evaluated for the presence of intermetatarsal bursitis or IMB and the rheumatoid arthritis MRI scoring system or the RAMRIS inflammation features, which include synovitis, tenosynovitis, and osteitis. Results show that IMB was frequently seen among ACPA positive, clinically suspect arthralgia patients, and those who have IMB were likely to have subclinical synovitis and tenosynovitis. The second study, on the other hand, abstract number 469, is by the group of Professor Xenophon Varaliakos, where they studied the imaging characteristics of patients with spondyloarthritis using a novel heel enthesitis MRI imaging scoring or the HEMRIS system. This was a post hoc analysis applying HEMRIS on data from the Achilles trial that included patients with psoriatic arthritis or axial spondyloarthritis, had clinical and MRI positive heel enthesitis, and were refractory to standard treatment, either NSAIDs or TNF inhibitors. Enrolled patients were randomized to receive either secukinumab at 150 milligrams or 300 milligrams or placebo. MRI positive heel enthesitis was defined as tendinitis or bone marrow edema in the area of the Achilles tendon and or the plantar aponeurosis. MRIs were then performed at screening week 24 and 52. Results show that the mean improvements in total enthesial inflammation and total structural damage scores were higher in the secukinumab treated patients compared to placebo. The Achilles tendon showed higher responsiveness compared to that of the plantar fascia. Among the secukinumab treated group, the highest mean change was observed for retrocalcaneal bursitis, peritendon hypersignals, and erosions. So, what do the results of these findings tell us? What is the added value of MRI, for example, in the early diagnosis of RA or as a monitoring tool for treatment among spondyloarthritis patients outside the setting of a clinical trial? Findings of the IMB study reinforces the idea that intra as well as juxtaarticular synovial inflammation is involved in the pathogenesis of RA. On the other hand, for the HEMRI study, it is possible to monitor the effect of biologics such as secukinumab on enthesial inflammation using MRI. It can probably be used as an adjunct to clinical findings when making treatment decisions. Because MRI is relatively expensive and not readily available in some areas, like from where I come from, its use may be limited to certain patients who may present atypically or those who show inconsistent clinical and laboratory findings. Follow me on Twitter at Rumarampa and tune in to roomnow.com for more coverage of the ACR Convergence 2021. Thank you.